Welcome, everyone, to today's program. I am Laura Dierda with Becker's Healthcare. The program will begin with a presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have, and will follow up on questions they do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. Amanda Sparks has been employed with Back Pain Centers of America, America's largest provider of qualified surgical candidates to reputable, board-certified healthcare organizations since 2014. Her primary focus is to build awareness of BPCA's services, offerings, and expertise, and to develop and maintain relationships with prospective facilities. Amanda has worked at length within the Atlanta digital marketing community and currently serves as a board member of Atlanta Interactive Marketing Association. Brent Wheeler leads the strategy and business operations at Back Pain Centers of America. With more than 16 years of experience, Brent has focused his career on the growing healthcare market with a strong discipline in orthopedics, forging strong internal and external business partnerships. It is now my pleasure to turn the floor over to Amanda to begin today's presentation.
Thank you so much for the introduction. On behalf of Back Pain Centers of America, I'd like to welcome and thank you all for attending today's webinar. Back Pain Centers of America works with several ASCs and small to medium-sized surgical centers across the country to help them alleviate pain points similar to what I imagine brought you to today's webinar. Some of these pain points include excess capacity from either not being able to fulfill your current physician schedule or recruiting a new physician into your practice and not knowing how to get more patients on their schedule. You may have fixed overhead costs that are either remaining steady or increasing year over year. And your marketing dollars are being spent, but you can't effectively track the effectiveness of your efforts, resulting in a weak patient recruitment strategy. If these pain points are some of the pain points that your practice is experiencing, we certainly hope that you'll leave today with a better understanding of the 5 things that you can immediately do to impact your online patient recruitment strategy. And we're focusing on an online recruitment strategy for a very specific reason, and that reason is your patients are online. Think back to about 10 years ago and how uncomfortable you would have been giving any of your information, credit card information, over the internet. And now consumers are using the internet to make purchases on Amazon, eBay, iTunes, and we're very comfortable with using the internet as a resource. And while it took a little while for the trend to catch on, it slowly and surely has made its way to healthcare. Where 5 years ago, a patient relied heavily on a primary care physician to provide them with not only the specialist they should go see, but how they should conduct the conversation, the patient is now turning to the internet to provide them with all of that information. I'm sure that you find within your practice that the patient is much more equipped with, and they're bringing in printouts from WebMD. They're bringing out tons of information that they've already collected online, and they're using the physician as a second opinion to what they've already determined is not only their ailment, but exactly how they want to get it fixed. And so let's take a look at a couple of stats. Of the almost 90% of American adults who use the internet, 80% are using that to research a health topic, and almost 60% are using a smartphone to research health-related information. Think about yourself day to day. You have a phone, a tablet, a computer. There are now cars with Wi-Fi. We are connected all of the time. And most importantly, 65% of consumers trust the internet as a reliable source. That is why the patient feels very comfortable coming in with their hand out and saying, I need this done, and you're the physician or the practice that I'm going to have it done in. The patient is always on. They have very high expectations for how they want to absorb information on the internet. They want to be recognized. They want to be spoken to. And if they don't feel like that through your digital presence, they're very quickly going to leave and try to seek that information somewhere else. And all of this is pretty commonplace. Nothing that I'm talking about is something that you probably already don't know. So you more than likely have some sort of patient recruitment marketing plan in place. The problem with these plans is that oftentimes they're very scattered. Your expertise is in solving patients' pain. It is not in marketing. And so oftentimes you don't have the infrastructure in place to really understand how marketing can impact how many patients are coming to your facility. And that's going to result in you attacking in silos. So you may find that you are launching specific initiatives. You may have heard, hey, you need to try this online. So you throw some money at that. It works or it doesn't work. It feels right or it doesn't feel right. So you try something else. And a lot of marketing is very reactive. And so you may find that you're missing goals, you're missing budgets. You want to go back to your primary strategy of relying on patient referrals, but you know that you have to do something else. It's just so hard to do. So what makes it hard? The typical patient recruitment marketing plan typically forgets that the physician is second to the internet for a diagnosis, and practices are relying a lot on reputation, and they're not considering how a patient is going to find them online. And so before we go into the 5 areas of focus, you really need to understand the patient online journey, and I'm going to turn it over to Brent to go into that with more detail.
Good afternoon. The patient online journey is something that we all need to be very aware of. Today, as Amanda mentioned, a number of patients are using the internet as their primary source to gain healthcare information. So today we're going to look at how the patient actually starts that journey. The beginning search, so anytime anyone goes to a search engine, the typical beginning search, according to Google 2012 hospital study, is condition or disease that they've been affected by or a loved one's been affected by. 49% of the time, when people begin their search, they begin on those conditions or diseases. 51% of the time, they don't. So as we move through this patient journey online, keep in mind, as Amanda had stated before, typical beginning search is around practice names. So that is almost like a word-of-mouth referral. They search for their doctor. They search for a doctor who they've been told about, word of mouth, or they search for the practice name. Keep in mind, when you think about those things in a word-of-mouth referral, that's not going to get it anymore, especially in the online world, because 90% of the time, they're looking for other things, not the doctor's name, not the practice name. So we have to think about when that patient begins that online journey in our patient recruitment process to make sure that we've got the other 90% of the market covered that don't know about you, that haven't been referred to you by somebody else, that don't know the doctor's name or the practice name to search on. Even though they start on conditions and diseases almost half of the time, typically the last search they do is based on the practice name or the doctor's name. And the result of that is because they have already seen your name, they've seen your advertising, they've heard about you out in the marketplace on some of those other conditions and disease-related type searches, or an advertising, even yellow pages in some cases. But 52% of the time, they still don't know you by name. They still have not been referred to you. unless you cover that 52% that are conditions, diseases, treatments, procedures, symptoms that that patient is feeling, things that ail them to get them to move to the next stage, which is then visiting your website. A little over half of the time, people are picking up the phone and call. And at Back Pain Centers of America, we recognize this. We monitor this data. And I would propose to you, do you know how many people are calling in from your website? Have you tracked those things? Do you know where that beginning search took place? And if you don't, you should. So today, we're going to talk about the journey those patients take online and kind of how we monitor things so that you can take some of these best practices back and ask yourself, are you prepared? Are you online? Are you doing what it takes to be effective at marketing to these patients online? And if you're not, what you can do to change that. There's over 900 different combinations that we look at that affect that patient journey online and that patient recruitment process. And we're going to start out today with the media channels. Some of you run billboards, some of you run paid search, Google AdWords. But as you get into these media channels, think about this. In paid search, in Google AdWords, there's some really unique things that you can do to connect with those patients online. Today we're going to cover ad text testing. So here's a typical Google search results page. Most of you have seen this, on the term related to back surgery. The top portion of the page, highlighted in blue, is pay-per-click, paid search. It's exactly what it says it is. You pay for each and every click that comes through those listings based upon that keyword, back surgery. The bottom portion of the page, highlighted in green, is your organic search. This is your area to connect with those other 52% of people through organic search, by writing expert content, by having doctors write articles related to conditions, diseases, symptoms, and have that connectivity with your website, with your patients when they're looking for you online. The top portion of the page is interesting, though, because this is where we're going to talk about the ad text testing today. These are the things that you, as a physician or clinical administrator, are in charge of. You can actually write these ads to appeal to your patients. So we want to focus a little bit on that today. Essentially, you can speak to your audience. Google allows you to speak to your audience through ad text testing. This is very simple for you to write. And we've taken 6 different sort of approaches today here based upon location, intent, empathy, reputation, direct response, and clinical. And essentially, location, you can see in the first listing, this advertiser has listed laser spine surgery in Georgia. Intent, we talk more about a condition or disease. Empathy, you can see there the ad and below the stars, get a free relief package and MRI review. Talking about relief. There are a number of different tactics that you can take when you implement these ad texts. It's essentially writing a simple, almost like a yellow page listing. When was the last time you actually checked? Are you running ad text? Are you testing these things? Or do you simply put up a listing that you expect everybody to resonate with? Google allows you to write these ad texts just like you would a yellow page listing that you put in a phone book, but you can put up 2 or 3 different ad texts, and Google will tell you which one resonates the most based upon the number of searches and keywords, and then you can apply that same knowledge that Google's telling you throughout the rest of your marketing campaigns online. Really crucial point, easy tool to utilize in Google, and this is something that we look at every day. Moving from ad text testing, we'll talk about the second and what I consider to be one of the most important components of the 5 ways to improve your online marketing strategy. And this is your website. This is key. when you look at landing pages, when you look at how many people call in versus fill out a form on your website. You have the ability to control all of those things. But the one thing that I say to the members that we work with so often is make it easy. Is your website easy? Is it easy to understand? Really, it should be able to appeal to an 8th grade level person. And if you can't make that connection pretty quickly, then something's wrong. So as you sit there and listen to this webinar, take an opportunity to think about what you're doing on your website, and is it easy? So here's where the fun begins. You've got to ask yourself, and this is a tool that we use all the time here, is does your site pass the blink test? Can you tell within 5 seconds of landing on your home page or landing page, does your patient, in the patient recruitment process, does your patient know what they're supposed to do? Do they know how you can help provide relief to them or a solution for their ailment? And if the answer is no, then you need to re-examine what you're doing. And it's something that we test all the time. So here's where the fun and games begin. The next slide is going to be a website that I want to show you guys, not related to the healthcare industry, but one that I want to ask you, within 5 seconds, are you going to be able to tell what these people are promoting? Here we go. 5, 4, 3, 2, 1. Probably can't tell just yet. Most people say taxes, tax preparation. Let's give you a little bit more of the page. 5 seconds have now passed. Can each of you tell me what that site was supposed to sell you? What service they offered? Probably not. Well, I'll explain to you. This is a company called Shoebox, and they essentially allow you to take pictures of a receipt with your mobile device and store the data so you don't have to keep up with your receipts when it's time to do your accounting. They've also made another huge error on this landing page, and I would advise against. If you look above the fold, and what we call the fold is the portion that you can see when the web page loads. You have what we call 3 different calls to action. You have a red button to learn more. You have to sign on with Google+. You have an orange button to learn more, or you can sign in with your email address. This is super confusing to the user. Same sort of practices apply when you look at your own site. And let me show you why. What do patients see when they land on your page? 40% of the people can't even see the bottom of the page. So if you're relying on the bottom of the page to sell your practice or your goods or services, what you provide as a doctor or physician's group to that patient, then you failed. But 99% of people can see that top left-hand corner of the page, as you can see there in the graphic. That is what we call prime real estate. And you want to connect with that patient within the blink of an eye, within 5 seconds of them landing on that page. That's your area. That's where you should focus. So if you go back and look at your website and you have not utilized that space appropriately to connect with that patient when they come to your site, then you may want to re-examine what's been done. And that's how we look at it here at Back Pain Centers of America. So then, once you figure out your real estate, then think about it. Did you connect with your patients? Did you begin them in that emotional component, that call to action above the fold? Did you tell them what they could do once they landed on that page above the fold and in that primary piece of real estate? Did you tell them why they're here? Did you build trust with that person? Do you have phone numbers in multiple places on your website that makes it easy for patients to find you, to call you, to speak? Remember, most of these people have a loved one or themselves that are in pain, They want to talk to somebody about it. Don't dissuade them from that. Make it easy for them to act. Make sure you use third-party validation. We'll talk about that a little bit later. And make sure that the treatments and the conditions, remember, a large percentage of people begin on that first search with treatments and conditions. And if you don't start those above the fold or give them some idea of what you treat, you've missed out. Think about that. The next piece is talking about desktop and mobile and the user experience on desktop and mobile. Not only do you have to focus on your landing page and your marketing message and connect with that audience on that page prior that we showed you, now more and more people are going mobile. And if you're not mobile friendly, you need to go re-examine pieces of your marketing to make sure that you are, because your patients are mobile friendly. For the first time in history, Google just reported to ComScore that the number of mobile searches around healthcare and everything else in the internet world just surpassed the number of people sitting at their computer doing desktop searches, sitting at home with a laptop in their lap. Now, more than ever, people are taking that mobile device and searching your practice, searching for their ailments, searching for those conditions. And remember, mobile has a 4-inch screen. So you have to work harder as a practice. And something that we keep our eye on all the time is to make sure that we connect with that person in that 4 inches of screen. Make it easy for them to act on a mobile device. You can see here on one of our sites, we've actually have a button that says take the first step. That button sends that user to the call center and we begin talking to that person. But make it easy for that person to get in touch with you. And really, small website changes make a big impact, especially with patients looking for you and trying to connect with your practice. And I use this analogy. Everybody talks about apples to apples comparisons, apples to oranges, but it's really here is an apples to apples comparison. But you've got a Granny Smith and a Red Delicious. And all of you know that they taste completely different. Still an apple. How do we apply that? Well, making those small changes, we took our page here, which we talked about before, Get Relief from Back or Neck Pain, where we've put all the elements that we just told you that it should be a good class act landing page up in the top left-hand corner. But then we start making small changes to these pages to see if we can actually connect with the patients even further, if there's wording that connects with these patients, if we can get them to take an action, to pick up the phone or call. We do all of these things, and we measure it. And it's important, and let me show you why. The impact of improving conversion rate is critical. Much like you look at your own tracking and analytics and data around how many patients did I bill out, how many patients did I get back from different, or how much reimbursement did I get back from different insurance providers, we measured marketing the same way, and you should too. If you're doing it on your reimbursement, based upon surgery, procedure, reimbursement rates, Medicare, Blue Cross Blue Shield, United Healthcare, you should be applying those same principles to your marketing. And it shows here when you start measuring online effectiveness of marketing. So take the chart here. Marketing expense of $5,000. Let's just say that this is the number. We generate 1,000 site visits off of those keywords like we showed you before off of back surgery. We have a 1% site conversion rate, means 10 people out of 1,000 that visited that site filled out a form or picked up the phone and called. Cost per lead of $500, internal conversion rate, meaning they moved through our patient coordinator and process here and became a patient of that facility. $5,000 cost per patient acquired. Now, ask yourself, are you measuring your marketing like this? Are you measuring the things that you're doing to be able to produce charts like this? Super important. Let me show you how it applies. Everybody is happy with a $5,000 cost per patient acquired. So what happens? Typical practices, typical companies say, okay, let's double our marketing spend. Still at a 1% conversion rate, spend $10,000, essentially produce 20 leads at a $500 cost per lead, and now we've acquired 2 patients. Everybody's still happy. But when you change something on a page and you isolate variables and you find the words that connect with your patients in that patient recruitment process, you can change the world and you can make your marketing efficiency online much greater. So what we did is we changed the words on the submit button to see if I qualify. Nothing else on the page changed. Well, what happened? Put that out, back into Google AdWords, we doubled our patient leads. We didn't change anything else. So in real world, impact of improving that conversion rate, now we say, let's spend $5,000 again. We've improved our site conversion rate by about 1%. And now we're getting 20 leads, but now because at 2% conversion rate, we've been able to get our cost per lead down to $250. And our cost per patient acquired has been cut in half. One of the other things that we look at is call handling. And call handling is super important. It's the step that the patient really connects with you in the process and connects with the practice. So we do all kind of different script testing where we test scripts. There's callback times. There's all the ways that you can handle calls. But to keep it simple, we'll talk about the call experience. Online patients are not referrals. Remember, 90% of the market does not even know who you are when they begin searching for you. So we've got to make sure that we handle those patients. And we've got to make sure that the phone conversations are different. And the people who are answering the phone and the clinics and the ASCs and all of the different folks that are talking to these patients, they have to know their unique selling point. Now, I know that sounds like consumer speak, but don't forget, the world or the age of healthcare consumerism is upon us. And these individuals have choices now. And by unique selling point, I mean, what are you the best in the world at? What is your facility? What is the doctor? What are you the best in the world at? And what we know is that little things like knowing the top bedside or having the top bedside manner for a doctor makes you the best in the world. It's an accolade. Being able to say, I have done more minimally invasive artificial disc replacement than practice B down the road. I've seen more patients related to minimally invasive spine surgery than anybody in the Northeast. Those are accolades. Those are facts that you can use when you're in that call experience. Also, these people look for consistency. These patients are looking for consistency in your message. So pull some of that information that you're getting that initially connects with that patient from your Google ad text that we talked about a few slides ago. Bring it into your phone conversations. What they're looking for. Bring it into your website. Bring through that consistent message and your brand message with that patient all the way through. That increases your patient satisfaction. It makes them feel like you care about them. And it doesn't stop with the call. It begins again when they enter that facility. They enter your brick and mortar location. Here's a real-world example. By following some of these practices, Back Pain Centers of America has transferred to one of our facilities a number of warm calls, and by having dedicated agents who are well-trained, who know what that practice is best in the world at, and having 100% phone coverage, never let a patient come in to a voicemail during your operating hours. But by doing that and following these simple steps, this facility is benefiting by having a 90% booked appointment rate versus a facility that's not following these simple steps and these rules. By doing these things, if we take the chart that we looked at a few minutes before, still haven't increased our marketing spend. We're still at $5,000. We're still acquiring those leads at $250 a lead, but now by following those steps that we showed you on the previous slide, Facility A has improved internal conversion rate to 15% instead of 10%, and you've almost cut your patient cost to acquire a patient or patient recruited in half again. Moving on to point 5. Foundationally, reporting and analytics make all of the things that we've talked about, the other 4 points, possible. And reporting and analytics is really key to your practice because it is the data that drives that decision making upstream. It lets you know whether you should change a Google ad text that would connect with that patient. It lets you know if your landing page message is resonating with that patient. Are you doing any of these things? Are you measuring what you're doing? Are you scorecarding yourself? Super important. At Back Pain Centers of America, we scorecard all these things because we know that the practices and the members that we work with, this is super important for us and for us to be effective working with them. We measure marketing channels. We measure website conversion. We measure call center database analytics. And we warm transfer these leads in after we've got all this information because it makes us that much more effective in the patient recruitment process. Now, I don't know how many people you have in your marketing department, but you should make sure that this portion is staffed because this is the foundation. This is where those practice administrators and executive directors and who's ever in charge of paying those bills for Google or whatever marketing billboard that you have in place, this is where when you start measuring these things, this is where you can go to that physician or surgeon or CEO of that organization and say, look at how effective we were in acquiring or recruiting patients online. Because often what happens is that CEO, that surgeon, that physician come to whoever's handling marketing and say, how many patients did we acquire, regardless of the channel? You should know how effective your spend is. Think about it if it was you writing the check. You have to have this in place foundationally for any of the rest of the things that we talked about today to be important, to be effective. And then defining roles and responsibilities. This is something that a lot of people forget. But everyone speaking to that patient is accountable in some way or form. Your marketing team is accountable for generating responses, for growth, for education, and generating that interest online or offline, whatever the case may be. Your receptionist is responsible. Their primary goal is to get to connect with that individual, to explain your advantage, what you're the best in the world at to that patient. Spend time educating. Don't forget, these people are in pain. They want relief. They're looking for somebody to be empathetic, warm, and educate them and make them feel comfortable and get them in front of that surgeon. And then that surgeon, their primary goal is to educate that patient even further and make sure that the patient outcome is phenomenal. And if they have to have surgery or conservative treatment or whatever that patient needs, that their charisma, their knowledge transfers into that patient and debunks some of the things that they've brought in from other online sources or gives them the right course of treatment. Everyone is accountable for speaking to that patient. And savvy medical practices are already doing this. You take the large ones like a Cancer Centers of America or some of these large national players in the medical world around orthopedics and spine. They're doing data capture. They're doing analytics. They're informed. They're course correcting based off of this data. It is super important, and you need to begin measuring and analyzing the data you get and what you're doing. And are you using the latest technologies or tools to be able to do those things? If you have an online presence, you should be. A little bit about us. We're the largest provider of patient candidates physicians groups across the U.S. Our primary goal is to bring patients and providers together. We handle about 150,000 patient inquiries annually. Our candidate profiles and what we produce are something like this. 99% have seen a physician, 85% have an MRI in hand, and 100% of them have private or commercial insurance. The benefits of membership with Back Pain Centers of America looks like this. We do a lot of the heavy lifting. We help marketing strategy. We recruit patient candidates. And we utilize analytics-based decision-making in everything we do. And I want to thank you all for your time today. And we would love to answer any questions or field any questions now that you have the time we have remaining.
Thank you very much, Brent and Amanda, for a very informative and enjoyable presentation. We will now begin with the Q&A portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A, and will follow up with questions they do not have the opportunity to address. The first question I have is, how much should a 1 to 3 man ASC spend per month on Google AdWords on average, and what kind of results might they expect?
Hello?
Oh, Brent, are you there?
Yes, I'm sorry. You cut out the last part. I got the question, so I think I can go ahead and answer that.
Okay, perfect.
Really, it depends upon how effective you are in your online marketing spend. I mean, you can spend as much money as you want to acquire patients till your efficiency starts to erode, and then you have to change something you're doing different to increase efficiency. But typically a 1 to 3 man ASC, what we see, $8,000–10,000 a month, somewhere in there from an online marketing spend. Some are more, some are less, depending upon how efficient they are with their marketing.
Absolutely. And then the second question I have is, how can I tell whether my current online marketing campaigns are effective?
Well, that goes back again to measurement. You know, there's one thing in driving leads to a practice. There's another thing in measuring how many of those leads actually turn into patients. So really beginning with what I was saying before around reporting, it's not difficult. It can be as simple as creating an Excel spreadsheet, putting the amount of dollars that you spend in monthly based upon whatever the marketing channel is, have a specific phone number for that marketing campaign, and then see how many calls you generate. And as those patients come in, ask them where they came from.
Absolutely. Perfect. The next question I have here is, My practice has limited resources. What should we focus on first?
I still believe that the website is the first thing that you should focus on, and making sure that is right, and adhering to some of the principles that we talked about today. Data in this world is one of the most important tools that you have at your resource, and utilizing that data, making the changes to your website that resonate in that patient recruitment process, how you connect, the empathy, like I had said before, the calls to action, those things are crucial in today's world from an online marketing perspective.
And it's an opportunity to put some content on your website around conditions, diseases, and treatment so that you can better capture patient candidates while they're beginning their online journey so that they're more apt to find you at the beginning instead of towards the end of the process.
Absolutely. Next we have tried to lead programs in the past. What makes your company different?
Well, a lot of people will claim to generate leads in the marketplace, and they can generate leads, but really being able to look at the effectiveness. It doesn't matter how many leads you produce. If you produce 100 leads and 100 of them turn into patients, you've got a really effective marketing campaign. But if you should know within the first couple of weeks how efficient those lead generation campaigns are, what makes us different is we guarantee, what we deliver. So we convert at a really high rate from a patient candidate into patient because of the things that we've got in place and because of the analytics that we've got in place. There's a whole host of things that make us different, but really it's just monitoring the effectiveness of the campaign.
Absolutely. Perfect. And I just want to remind our listeners that we are still taking questions. We have time for a few more, so if you have any, please feel free to enter your questions in the space labeled Enter Question for Staff and then click Send. The next question I have here is, please give us your thoughts on compliance, specifically HIPAA, in your current marketing process.
Oh, that's a challenging question, but it's one that we deal with a lot. Essentially, our current marketing process is all of the data that we capture is HIPAA and PCI compliant. We handle a number of healthcare clients. Some are e-commerce related, some are where we generate patient candidates. But that we do have a HIPAA compliance process in place. And then our current marketing processes are set up so that those processes are not violated and that we maintain regulatory and HIPAA compliance in all of our marketing campaigns.
Absolutely. Perfect. Well, I would like to thank our presenters for their excellent presentation and for all of you for participating today. We look forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.